This is the reason why you see why it is used in the pain clinics. If you go to pain clinics, they do a lot of times use the ketamine for pain. So you could also use for burns, dressing, and wound care. So they found out that's also effective for the psychiatric conditions, which include the traumatic treatment-resistant depression, bipolar depression, post-traumatic stress disorder, suicidal ideations with the depression, other conditions, OCD, and anxiety. The data on OCD anxiety is somewhat less. There is a recent paper that basically looked at the people who have depression, PTSD versus just depression alone. It seems to be more effective in PTSD depression, but does not mean that it doesn't work in depression. It works wonderfully in it. So, esketamine and enantiomer is the efficacious major depressive disorder, as you can see. A double-blind control was done in 13 to 17-year-olds with a CDR score of 40. Well tolerated, causes significant short-term efficacy lasting 2 weeks compared to placebo. So a retrospective view, basically like a long-term oral ketamine in patients with PTSD reduced hospital admission by 65%, inpatient hospital stays by 70%. Treatment-resistant generalized anxiety disorder, social anxiety, ketamine improved anxiety within an hour, with the effect lasting up to 1 week. Esketamine during the electroconvulsive therapy reduced the number of sessions needed, produces lower depression scores. Again, these are very few studies. They need more studies to really look at this data. So typically the doses used in the ketamine for the treatment of depression are much lower. They start at anywhere between 0.5, the max is 1.0, and usually even lower, like 0.25 is basically used. For anesthesia, they start at 0.25 to 0.5, and then they go up to as high as 1.5, which is also used in pain. And the higher doses sometimes they use, but not quite often in anesthesiology.